Okay, so when I had this patient, I was super excited for the visit number 2 because this is one of the rare times where we get to treat along the entire trajectory of the nerve. Why is that so exciting? It's so exciting because we get to use different treatment techniques along each segment of the nerve. Come and check this out. So we know we want it to start from the entry point of energy, which would have been the entry point with the car door slamming on the hand. So this is called a short circuit technique. A short circuit technique is something that I haven't even taught yet, but I use it pretty often, and it's along the sensory trajectory of the nerve itself. This is the superficial radial nerve. So at one end, we have the superficial radial nerve at the snuff box, and at the other end, it's at the radiohumeral joint in this vicinity of lung 5. Not exactly, but lung 5. So what I run at low frequency is I run this with my Edo at low frequency. And what happens here is sometimes we get a contraction of the motor fibers of the brachioradialis or whatever muscles are in the vicinity. All right. Just let me know when you feel it.
You can feel it a little bit.
There we go. So you can see here, because we're not in the vicinity of many motor fibers, that's not the intention. What the patient needs to feel is a sensation in this area, a neuromodulation, because we want a non-noxious stimuli to decrease the spinal sensitization at the spine and then locally at the area of the superficial radial nerve. Doing okay?
Yeah.
Great. Next, up here, this is along the lateral intramuscular septum. We have an inline technique, and the purpose of this is to provide non-noxious stimuli along the heart of the radial nerve to neuromodulate the motor and sensory fibers of the nerve. So what I do here is I cross one here, I cross one here, and as you see, as I'm talking here, we're getting a relaxation of the tissue. See, we're getting more of a contraction. Okay. And now you're going to feel a little pulse here. And let me see what kind of a contraction. Let me see, get more of a contraction. There we go. Doing okay?
Mm-hmm.
So just back pan just to kind of give everyone a picture of what we're seeing, and we'll come back in. Great. We're covering this segment, an inline technique. On this segment of the radial nerve. Now, I want to show you the back part of the radial nerve when it wraps around the rear of the humerus. And we're going to switch places here. So the best way to do this is what we want to do is we want to neuromodulate back into here. And there's no better way to neuromodulate than use a motor point. And so what I've done here, this is the motor point here, and one is just to pair it because we use a 2-needle technique here. I just want to show you the stimulation of the motor point. You can see that moving there, moving the entire long head of the tricep. Good. That tells us we're in the right place. So what I'll do here with the 2-needle technique, and I'll still run it at low frequency. Why? I run it at low frequency because my goal is non-noxious stimulus. My goal isn't motor activation. My goal is to neuromodulate that nerve so that, I just lost something here. So we can desensitize it. Now you're going to feel a little pulse right here. There we go. Doing okay?
Mm-hmm.
I'm going to make it closer to 2 hertz here. So we have the 2-needle technique here, where the radial nerve wraps in behind the posterior humerus and tricep along the intramuscular septum as we just move up and over intramuscular septum. And then here from the radiohumeral joint, the start of the superficial radial nerve, down to, and I'm just going to have you turn your hand so we can better see that. And now I run this for 10 minutes, and this sets the stage for the second part of either the second visit or the first part of the third visit, which will be the manual release.